Hello, everyone, and welcome back to Beyond Adjustments. Today's roundtable, we're doing a panel, is all about getting real with chiropractic modalities, maybe. I don't know. We'll get into it, but not just what chiropractors do, why they do it, and the science that makes it practical. This isn't just surface level stuff, guys. We're cracking open, yes, I did it, the research, the proof, and the stories that show how these modalities or these services actually play out. And yes, pun intended, we're cracking open the conversation. You knew that was coming. Let's start simple. I'd love for each of you to introduce yourselves with your name, your practice, and maybe one modality that you feel most confident standing behind with the science, of course. Dr. Juan, we'll start with you.
I'm Dr. Juan Escobar. I'm the founder of ESCO, Elite Sports Chiropractic Optimization. Basically, we focus on helping athletes or active people recover from knee and musculoskeletal injuries without surgery or medication. Now, one of the main modalities that I particularly use in my practice is definitely the shockwave therapy, more specifically shockwave therapy, which is the type of shockwave that I use in my practice.
Love it. Dr. Brett.
Yes, I'm Dr. Brett Judson, the owner of Judson Chiropractic in Tom. And the primary modality that I use, I guess we can call it a modality, but it's an active release stretch after an adjustment. It has properties of myofascial release, and it gets, some soft tissue work to help with the muscles, and patients love it. It really adds some bonus effects to the adjustment.
Thank you, sir. Dr. Justin.
Dr. Justin, Charlotte, North Carolina. I have Clear Life Scoliosis Reduction Chiropractic, where we're really good at focusing on scoliosis reduction. When everybody says it's impossible, it's not impossible. We just have to focus on the spine and the spinal injuries and rehab the spine itself. We found the most beneficial, as we're looking at modalities, is the soft wave, shock wave modality. There's great science behind it, as we'll dive deeper into soon.
Dr. Josh.
And I'm Dr. Josh Collingsworth here in Virginia Beach, Virginia at True Source Chiropractic. We are a family practice where we specialize in pediatrics and prenatal care, but we offer decompression therapy for those who are dealing with chronic low back pain, disc issues, sciatica, facet syndromes, things of that nature. So very comfortable in talking about that, and I'm excited to get into it today.
Love it. Thank you, gentlemen. Thank you so much. All right. So again, let's crack into the foundation. I want to talk about adjustments. Sounds simple to any kind of a layman like myself. Oh, you go get an adjustment. And adjustments have been really the cornerstone of chiropractic, since the dawn. But the question is, are they still practical today? Like in a modern healthcare landscape? It seems to me, well, one, yes, right? I don't know what I'm talking about, but it's become like this fad, you're seeing all these TikTok videos and they're miking people up and all that. And that's fine. That's whatever. It is what it is, but that's what it's become. So I want to get into a little bit of what it is, why do we use it? And I'll start with eeny, meeny, miny, Dr. Josh.
Yeah, I think that, when we talk about chiropractic, the word chiropractic means by hand, right? So we're really paying homage to what was when Dr. David Palmer, D.D. Palmer, and his son B.J. Palmer, and how it started, how chiropractic originally started. I do think that there's a lot of validity, even in today's landscape, where there's a lot of technology. There's new instruments that are coming out. There's even adjusting tools out there. But I do think that there's nothing quite like the human touch. And when adjusting, we have to understand why, right? Like you mentioned, us looking at TikTok or Instagram or Facebook or whatever, and people, that sensationalism of, hearing the pop or hearing the crack or the cavitation, that's become sort of what people are looking to get in our office. But then the education component comes in. It's like, okay, what exactly is that and why do we need to do it? When we talk about subluxations or stress on the spine in our office, we're really looking to relieve the neurological symptoms, which then kind of offer more tangible benefits in terms of the functionality of the human or the person. And so we're really trying to improve function by way of the nervous system. And so we're taking stress off the nervous system when we do a manual manipulation or an adjustment. And I think when you explain it like that, and it's not just like, oh, you can just have your son walk on your back and make those noises. I think
Mhm.
when we start to explain the why and the how, people start to appreciate, okay, there's a lot more to this than, kind of meets the eye or meets the scroll, if you will. So, that's kind of where we take it. It's not just, we're making, pops and cracks for the sake of it. There's a lot of science behind it. And there's also, for us as chiropractors, there's a lot of education and learning how to do this in a very safe, effective way.
Thanks for that. So I have a question, and Dr. Justin, I'm gonna throw it to you here in a second, but um, I don't necessarily believe this myself, and I want like I need a tool and some sort of something in my arsenal here in my bag of tools to be able to answer this question, because people will in conversation um will come to me and say, well, spinal manipulation or adjustments are just as effective as, physical therapy or meds, right? And it's just for short-term pain relief or what have you. Um, I I lived that it's not, but I'd need a little more substance. And Dr. Justin, I'd love for you to kind of dive into that a little bit if you can.
Uh, sure. Dr. Josh gave a great introduction to chiropractic. Thank you, Dr. Josh. Great history. Chiropractic is founded in the late 1800s, right? And we've been building on that over and over through the years. And so what we're talking about today is going to be probably obsolete in 20 years, right? Because we're building on stuff. We have decompression in here. We have ART in here. We have soft wave in here. So today's topics of, some of the things that we're going on and is discussed in the public view is probably 30, 40 years outdated, right? And so the new science takes years to come out. But when we're looking at this, are we the same as PT? No. Are we the same as medication? No. Every doctor in the world knows what the spine should look like, right? Spinal injuries are the number 1, 4, and 6 years of chronic pain disability, headaches, low back pain, and neck pain. Right? These are spinal injuries. There's 220 ligaments that hold the spine together. 23 of them are discs. That's all everybody talks about is a disc. But surrounding those discs, if you go to Dr. Joss's office, are 197 other ligaments. They hold the spine together. So if you blow out a disc, you've already blown out all these other ligaments, right? PT doesn't have that. Medications don't have that. Chiropractors have this. Chiropractors can focus on this. This is where we shine, right? If we know what the spine's supposed to look like, every doctor in the world knows that the spine doesn't look like that and doesn't go back to that position. We know we have a high percentage, high risk of things getting worse very quickly, very, very quickly. This is why when you take an x-ray today, you take an x-ray in 20 years, you say, whoa, wait a minute, look at all this degeneration in there, right? We have spinal injuries in there that create excessive motion, which creates different type of buckling patterns, which creates accelerated degeneration. So as chiropractors, what we want to do is restore the spinal structure, get it to stabilize, and now we're talking about long-term changes. I hope I answered your question.
I think you did, but could you elaborate a little bit on, so you mentioned spinal injuries. Actually, when you and I spoke the last time I was in your office, you did mention something about you trying, I think, to publish something around that, or you're working towards something around the spinal injury piece. But could you explain to someone like myself what, a spinal injury is? Because to me, like, if I think spinal injury, I think, oh, I fell off the roof of my house, right, and cracked my back. Like, what constitutes, or what really defines what a spinal injury is?
A great question. And yes, I did publish it last week.
Nice.
So in scoliosis, every scoliosis patient has excessive motion in their cervical spine. So when they bend forward and bend backwards, we know that the spine should move like X, right? And we have parameters for that. These are across the board American Medical Association parameters, right? So we're taking these parameters, we're taking flexion, extension views, and we can quantify exactly how much each segment of the spine moves, right? And when it moves too much, we know that, hey, there's a problem here. We can correlate that with our neurological physical, both myotomes and dermatomes, so what our muscles do and what our skin sensation looks like. And now we have definitive spinal injuries, right? So if we're moving too much in a flexion extension, whether it be the neck or the low back, and we correlate that with the myotomes, the muscles, as well as the skin sensations, and we correlate that with the x-rays, now we're looking at definitive spinal injuries. Those could be disc injuries, or more importantly, in my opinion, and what I do in my world, is the other 197 ligaments. And these ligaments can create all kinds of problems, right? Can create ringing in the ears, create eye problems, jaw problems, breathing problems, bowel problems, bladder problems. You see where I'm going with this, right? Eye problems.
Yes.
It can create all kinds of problems. And so when these injuries are there, it's just very similar. If you sprain your ankle, but you don't actually rehab it, you're just going to kick the can down the street until you have a massive problem.
Makes sense.
So in that paper, I correlated adolescent idiopathic scoliosis cases, 37 back-to-back cases, and all of them had abnormal cervical mechanics, which means all of them moved too much according to AMA standards. And they also created a buckling pattern. So the uromyelus buckling actually deformed the cervical spine. And if we look at the science of it, all scoliosis patients have a decrease in proprioception, which is your awareness in space, as well as it decreases your leg lengths and the internal organs. So if we start with a problem all the way up in here, that translates all the way down, that's a possible upwards problem that we have in the neck that may manifest down lower.
Where is the paper published?
It's on Curious. You can look at, I believe it's titled Retrospective Cross-Sectional Analysis of Abnormal Cervical Mechanics with Patients with Scoliosis. And it will be indexed next month.
Love it. Thank you, Dr. Justin. We'll get that out too in the description when we publish. But Dr. Brett, I'd love for you to weigh in on, again, kind of the baseline adjustment and why you feel it is effective, what it does for your patients. You know, maybe provide me a real world example of one of your patients where that specific service or treatment help them.
Yeah. I mean, every day with every patient, it's, small miracles with each one. Every time they get up out of or off the table, I ask them, how are they moving? And they go, oh yeah, that's so much better. Right. So it's everyone, but, the adjustment, I take a very biomechanical approach, very simple approach. There's biomechanical dysfunction. And so we have all these joints in our spines, and I try to, use my hands just to try to say that, each segment moves a little bit and they all work in harmony to create the movement. And when there's a kink in the hose, or when there's, a wrench in the gears, that provokes abnormal movement, right? Just like if there's a pebble in our shoe, we can feel it. There's something wrong, and our brain can sense that as well. And so it's not going to, put sirens yet, because it's not really an issue, but that adds extra stress on the ligaments, on the muscles, until you do something that's too much for it, and then you get injured. Right? So I tell our patients, that's what I'm correcting. I'm correcting the dysfunction. And after that, it's up to your body. And my goal is to keep things in motion and keep the stress off of that area, keep that magnified stress point away from that spot so that your body can heal. So looking for movement after an adjustment. I'm not looking for pain reduction, right? It's your job to heal. It's my job to keep you moving, kind of a thing. And so simply put, I'm looking for the biomechanical dysfunction, the restricted motion, and I'm restoring that. And restoring that has this chain reaction effects of nerve interference, organ dysfunction, right? All this potential symptoms that can be caused from a biomechanical problem.
Okay. So then I have a question for you guys, and I'll have you, I guess, weigh in a second here, Dr. Juan, on the adjustments. But my experience specifically, and experiences of people around me with chiropractic care and adjustments specifically, I've seen a difference, right? Like I can see the difference in the person's quality of life. It has not just oh, it's not pain relief. I've seen it. If that's the case, and patients are seeing these kind of results, I searched the world for this stat and I couldn't find anything more recent. But I think so I found this stat on from 2022 that I think it was 11%, 10 or 11%. I can't remember. I should have wrote it down. Of U.S. just adults specifically got a chiropractic or received chiropractic care. For me, that's a really low number because I think everybody should be, even for just preventative in chiropractic care. But 11% U.S. adults, and what the stat said was that it back from like 20 years before then, so 2002 was like 7%. So yeah, it went up, but it was like nothing, like 4%. To me, if we're seeing all this difference, right? And we can, feel our bodies healing themselves the way that God designed them to. What do we feel is the blockage? What's the hurdle here? Why aren't we getting more people inside of chiropractic offices? And if an adjustment alone can do what we're saying it can do, like what's the issue? Like what are we facing here? Dr. Juan, I'll have you jump in here since you haven't weighed in yet.
Yeah, sure. So, I mean, I'd like to talk a little bit more about spinal manipulation,
Please.
because I still think that it remains practical, even in the type of practice that I run, really for three main things. Really, it improves joint mobility, it optimizes nervous system input, and it supports overall biomechanics. So for knee patients, improving spinal mobility can actually directly influence movement patterns and also reduce compensatory stress on the joints. And just most recently, what comes to mind right now is a systemic review. I believe it was Page in 2017. And it showed that spinal manipulation actually improves function and reduces pain. So there is research out there that helps correlate, what we do in our office with actual efficacy and results. Now, as far as like why not enough people or why the general population doesn't necessarily seek out this type of care, I think that there's a lot of skepticism, and there's a lot of just hearsay, and people kind of afraid, because spinal manipulation in some cases can look perhaps a bit aggressive, if you want to use that word, to somebody that's never experienced that before. I think there's a part of perhaps fear in that. But I just think overall it's just a lack of education, that people just aren't just aware of what it actually is.
Mm, mm. Um, it- and hence why we're on the show, right? Because we want to educate. But um, there's and even over time, again, this is somebody from the outside here. Like I'm not as smart as you guys, nor will I ever be. But like even like looking at we'll call it injuries or side effects from going into a chiropractor, like nothing. I mean, you're sore. That's it. Like nothing's really going to happen to you. The benefit way like outweighs like the little soreness that you might have or a little pain in the moment. There's no real serious risks, especially if the doctor has been trained well and does the job the right way. So again, like I feel like with what do we, chiropractic has been around for what, 100, 120 years now or something like that? Am I off in saying that? I mean, I feel like it being around this long, we should be farther along than we are. Dr. Justin, what do you feel like could be this kind of block or this wall that is stopping people like myself walking into a door of a chiropractic office to say, help me get better?
I think there's lots of barriers. For like myself, I don't market a whole lot, right? Because I'm such a specialty clinic. The other barriers are, we are natural by hands, as we were talking about earlier. We're natural. I would prefer that I myself or my family not stay on drugs, right? And so we have a multi-trillion-dollar companies that are pushing drugs everywhere. And so they say, here, you have a headache, take a Tylenol. you don't have a lack of tone on your body. It's not like you have a headache, right? And so my opinion of where we go is, hey, I'm not necessarily a quick fix. It might take a couple of months of true care to get things moving, right? So we might be doing adjustments, right? We might be doing some manipulations, whatever you want to call it, but we need to get to the root cause of the problems and not just try and mask things. And so what I've seen in the big city of where I live is we're such a hustle and bustle with people that the commitment to take a Tylenol is a lot easier than the commitment to actually truly improve your health from the ground up.
Okay. All right. So then leads me to, I'm going to wrap this kind of segment up here a little bit, because I think we could probably talk about this for the whole show, honestly. But one thing I wanted to ask the entire panel, and feel free, whoever wants to jump in first here, but to talk about the adjustment itself when it comes to what, like, I'm not asking you here to, teach me to become a chiropractor, but to me, if I don't hear a crack, nothing's happening. But obviously, when you guys are making the adjustments, you're feeling the spine, like what's moving, what's not moving. Like, what can you explain to me a little bit more? Like, how do you explain the real science behind it if I'm not hearing a crack, but something is still happening?
Yeah, I mean, I'll take this one because I adjust a lot of children, and the idea of a crack on a baby, I would never implement that, but the people coming in, that's what they're fearful of. And so when we adjust, we're actually looking at tone. And I think I've mentioned this before on your podcast, but the tonality of musculature, and what you're feeling. And you can feel a child who is just not being able to relax. You can feel an adult who is unable to relax. I mean, they lay down on the table and their shoulders are up by their ears. You can feel that, right? And so anytime that people are like, oh, I didn't hear anything, and I'm like, I'm not going for the sound. I'm not going for the sensationalism of this. I'm going for what your body is kind of innately and intuitively telling me. And what that is basically allowing the body to relax enough so that signals can transmit up and down. A lot of times when there's subluxation involved, there's a few different components. And I think everyone probably in this panel would agree that when there's a subluxation or when there's misalignment, spinal misalignment, yes, the obvious thing is you have pain. It's why most people come in to see us. Okay. Yeah, we want to obviously get rid of that, but it's usually the last thing to come on, right? There's obvious muscle tension. You have, the Golgi tendon organs. You've got muscle spindles that kind of tighten and wire each other. And then you've got, actual functionality, right? So now function has decreased or diminished to some degree or capacity, right? So really there's a trifecta of what we're after. Symptoms are just the thing that brought them in. So when I tell people, hey, I'm adjusting you, and they're like, oh, I didn't feel anything. Great. That's amazing. Because this is not something where you need to quote unquote feel something for it to happen, because up until you had pain, you weren't feeling anything, but things were happening. Correct. And so that's where we start unwinding and having that conversation that, don't confuse an adjustment with a noise or a sound or a feeling. You need to understand that there's a deeper seated root there. And that's what we're trying to tap into.
Anybody else have something to weigh in here before we kind of shift over?
I'll weigh in on that a little bit. So I like to tell patients that the cracking is not the end goal. It's a byproduct of adjusting. So you may or may not hear it. And then I also like to explain what the sound that they're hearing actually, what is it and where it comes from. So I tell patients that basically when you take any joint to its full range of motion and then just pass that slightly, there's an increase of pressure in the joint capsule, which releases a gas, which is mostly nitrogen gas, which is what helps to lubricate your joints. And so that release is what you're hearing. That's that crack. But it's not like what we're aiming to do. We're aiming to have joint mobility and get that joint to move adequately. And sometimes it doesn't necessarily evoke that sound or that crack.
Thank you for that. And anyone else would like to weigh in?
I'll just say one thing, I tell patients, I have patients that come in and they, crack like fireworks every single time. And then there's some that maybe I'll get a pop out of it. I mean, but I tell them that the measure of a good chiropractor is not the amount of pops that they get out of your spine. you know, that's not what we're trying to do. Like Dr. Juan said, it's mobility. So if things are moving, even though they don't make a sound, that's very likely. So get up, move around. And then 9 times out of 10, they're like, oh yeah, that is moving better. Oh, it didn't hurt when I, took a longer step than it used to. So, that's kind of the proof in what we're doing is, increasing mobility and having them move around after the adjustment, them going, oh yeah, that does feel better, even though it didn't pop. And then sometimes, even though it pops a lot, patients will still say, still kind of catching a little bit. And then I go in and just kind of find out what muscle is going on, and we stretch that out. And then afterwards I go, oh yeah, so maybe it wasn't a joint restriction problem, but it was the communication between the brain and the muscle and that moment. And then we release that muscle, and then they, oh yeah, that's moving better. So not just the pops.
Gotcha. Dr. Justin, you want to weigh in here?
Sure. All of us is taught basic mechanics of the spine. We spent probably a couple of years learning about mechanics of the spine and the communication with the brain and the body back to the brain, right? And so when we look at the adjusting and the popping that you're talking about, it really it means nothing to me as a doctor, right? Especially as somebody that works with the biomechanics and restoration of biomechanics. But when we take those flexion extension x-rays, we know without a doubt, almost all the time, specifically if somebody's coming in from just different types of injuries or pain, we're going to have hypermobility segments, which means we're going to move too much. And again, this isn't Dr. Justin saying this is basic AMA standards, right? When we have areas that move too much, we're going to have areas that don't move enough, which are what we're all talking about, restricted, right? So we have to be very careful on manipulation, whether you're a physical therapist or a chiropractor. What are we manipulating? Is it a segment that's moving too much? Well, if it is already moving too much and you just want to hear that pop and that crack, great, you got the pop and the crack, but it's already moving too much and already damaged in that area. The pop and crack, I'm really crude in my office, sorry guys, but you can hear your pop and crack and it's completely natural, right? My analogy is cocaine is completely natural. It doesn't mean it's actually good for you, right? And so we want to make sure that we're adjusting appropriately. Right? We want to make sure that we're solidifying the areas that are hypermobile. We want to make sure that they're not moving nearly as much. And if they're not moving enough when they're restricted, like the other doctor was talking about here, we're getting motion back in them and we're restoring structure. So that pop and that crack might feel good, but it doesn't necessarily what's good for you. Right. And so we get these hypermobility, specifically when we're talking about today's society with tech snack and all this other stuff. We know that our liability insurance is almost nothing compared to every other doctor. Right. Are people scared of the pop and crack? Yeah, sometimes, but people's car insurance costs less than, it's my malpractice insurance is less than their car insurance, right?
Wow.
You don't actually hurt people. Working on restoring structure will make long-term changes really good. We have deficiency, we reduce all kinds of different symptoms on top of that. Increase longevity, quality of life, all kinds of really good stuff there.
You made a great point there.
I don't really adjust that way in my office. It's similar to the other doctors here. We work on restoring structure. I've adjusted under video fluoroscopy. Restoring your structure perfect in 2 minutes without a pop or crack can be done.
You made a good point there when you refer to the insurance policies that you guys have to carry. Like, we live in an insurance driven society, world, community, government. Like, everything is just like insure your car, insure. And if we look at the insurance that a medical doctor has to carry, the malpractice insurance that they have to carry, it's like quadruple and maybe even sometimes 10 times more than what you guys have to pay. Like, if we put that into perspective and somebody actually just thought about that piece alone, it might actually just change their mind about chiropractic care in general. But we'll let that simmer and see whoever's listening to that, see if that actually helps. But so what we're basically saying here is that, we're not a Pringles can, right? Once you pop, you can't stop. No? Okay. Sorry. Bad dad joke. Okay. We're going to move on from this. We're going to talk a little bit about the technology around, and the science around, and actually before we get into that question, laser therapy, I hear laser therapy and I hear shockwave therapy. Are those two different things? That's first question. Okay, cool. We're going to touch on laser therapy, and I'd actually like to talk about shockwave therapy as well. But let's talk about laser therapy, and we'll shine a light on that. Literally, wow, the dad jokes, they just keep on coming. Unbelievable. On laser therapy, some say it's the future, and some will tell you like it's just hocus pocus, and it's just like this nothing. It's just a trick. But I want to unpack it, right? So, Dr. Juan, I'd like to start with you when it comes to laser therapy. Just give us a little background as to what it is, why you use it, if you use it, and I believe you do. Well, I know you do because I've been to your office. But tell us why you use it, what it does, how it helps, kind of at its core.
Yeah, for sure. So I use a class 4 laser in my office. And basically what it does is it boosts cellular energy, or ATP. It reduces oxidative stress and accelerates tissue repair. Okay, so there's a meta-analysis and clinical reviews that actually confirm that properly dosed, and that's a really key thing with laser, because the parameters in which you use this thing and how you dose it really, really make a difference with efficacy. So making sure you have the proper dosage really improves the tendon and joint healing. Particularly in my office, what I've seen using decompression for the knee and laser therapy, I mean, you could see even changes after one session, right? Increased flexibility, reduction in pain, even just with one session when used properly. So laser therapy is definitely a big modality that we use in our office. It certainly helps really expedite that healing process at a cellular level.
Mm. What does that mean? Like what's actually happening at the cellular level?
So you have your mitochondria, right? Remember that from science class?
I
Powerhouse of
I
the
put
cell.
that behind me, please.
So yeah,
PTSD, man.
right,
Come
so
on.
this is where we produce
That's why I'm in
literally
tech.
all of this
Just
is where we produce all
go
of
ahead.
our energy, basically, to be able to be alive and for our cells to function. And so, with the American diet, standard American diet, and being sedentary, we see a population very deficient in mitochondrial health, right? So that really slows down that healing process. So what the laser therapy does is it goes in there and actually will stimulate or boost that production of ATP. It also increases blood flow because it stimulates something we call nitric oxide. So it dilates those blood vessels, bringing in the nutrients that your body needs faster. And at the same time, it actually gets rid of the poor or the bad inflammatory repair tissue cells that are in there as well. So, I mean, from a cellular level, it's really more talking about like the mitochondria and getting that mitochondrial health to improve.
Mm. So I also looked into laser therapy, kind of tried to find some research behind that, just to understand it a little better myself. Most of it went over my head, but like there's the evidence, at least from from the things I hear from you, Dr. Juan, and from some of patient stories and things like that. It's promising, but from what I've been reading, there's a lot of inconclusive reports and mixed results, really. But
A lot
based
of
on
that
what
is
you're,
attributed to the dosage, like I mentioned before.
mm,
If you don't dosage it correctly, or if you're not consistently performing within the same parameters, there's a very discrepancy in results, even if you're using the same laser for the same condition with a large sample size. So really, really important to hone in on that part when
mm,
using laser therapy, because it's really easy to, because it's very skill dependent on whoever's using. There could be a lot of user error, making sure that you are staying within correct parameters and having the right dose is very critical when it comes to this. So I feel like that's where there's flaws in a lot of the research out there with laser therapy. So
okay. So show of hands on the rest of the panel here. Who else uses laser therapy in their office? No one else. Is it because you just haven't brought it into your office, or what's the story behind that? I'd like to understand that a little more. Go ahead, Dr. Brett.
I had a sales rep recently come to my office, and his was an MLS laser. He said it was different than class 4. It was like 2 class 4 lasers with 2 different wavelengths, and they penetrate deeper. And he was really big on, well, we are the only one that has a robotic arm with this type of a laser. And in any case, I had him come in and, showcase it, do it with a couple of patients. Actually, one patient even was like post-surgery. He had an ACL repair, and so I asked him a couple of days later. It was just one dosage, and I understand that you need to do it for, I think he recommended at least 6 sessions over the course of a couple of weeks. And in any case, I like faster working things. And so I know there's patients and things like that, but I'm in a kind of my demographic where I'm at, the population is a little bit different. The mentality is a little bit different. And so it wasn't very attractive to the patients. What they were feeling just after one session, it wasn't what they were wanting. They said, maybe I felt a little bit different. And I said, well, what if, since it's not insurance, well, would you pay an extra, even $60 per session? And then when they said that, they go, oh, no. What you're doing is just fine. And so to me, it wasn't necessarily trying to convince them that this is going to be better for them, but sometimes even though something may be better for them in their healing, they'll opt not to do it based on financial things. But then there's the question of, well, was I educating them appropriately to increase the value of that therapy? And so that was kind of my experience. And so I haven't, pulled the trigger on laser therapy for that reason. Plus, it's just myself and my receptionist in the office. And so my dynamic, I didn't want to add a whole nother employee to be able to do that while I'm adjusting other patients. You know what I mean? So it didn't quite fit exactly, but we'll get to this later, but shockwave is kind of what I'm more leaning towards, but right now I'm talking about laser. But that was my experience with the laser just on one day. And it's probably not an appropriate amount of time that I practiced or tried it out, but that's just kind of what the feeling that I got.
Okay. All right. Well, we are going to lose a participant here in a little bit. So before you actually have to jump off, Dr. Josh, I'd love your weigh in on this topic, if you don't mind.
Yeah, I love laser. I just haven't brought it into my office simply just because of the cost of it and what my practice is operating at right now. It was just not high priority on the list of things to put in here, but I've seen some tremendous. I mean, I used to work at an office as an associate, and we used laser on just about everything, and it made a massive, massive impact, especially on like our disc issues and people with like plantar fasciitis. We used it for everything, and so I became a big fan of it. I initially thought, coming out of chiropractic school, that it was kind of like, FUPA, just a light kind of deal, but there's actually been tremendous research on it. I've seen it firsthand. I've used it on myself. I've seen it used on people and have used it on others. And eventually I think I will add it to my decompression practice. It's just, again, something it's not high on the priority list right now.
Gotcha. Dr. Justin, would you like to weigh in here?
Sure. Each one of these modalities, they each have their own benefits, and they are great when utilized appropriately, like what Dr. Juan was talking about. Laser is phenomenal, shockwave is phenomenal. I also have the PMF in here, which is magnets, right? Really, really cool magnet. We have vibration therapy in here. We have a lot of really neat modalities to help the body heal. Essentially what we're doing is we're talking about getting into quantum physics and how do each one of these wavelengths or does this magnet interact with the body, and how does the body adapt with that appropriately? And each one of these are very good for specific things. So it might be really good for decompression, or some of it might be good for stem cell regeneration, right? Like the soft wave, which are really, really neat. And so if the practitioner has a really good handle on stuff, PMF is a really great set and forget. You can put them down for 20 minutes, set and forget. It sends in a magnet through the body, helps the body calm down. You can put people into a parasympathetic state with that, a relaxation state. Does some really, really neat stuff. People can add those in the office and get really good results and not a whole lot of extra commitments with office staff, right? And so each one of these can be really, really good adaptation or really good addition to the office. And we do use those. I like to use those a little bit more minimally in my office as I will restore structure, as well as then use these to help the body adapt. Kind of like decompression he was talking about. He can better results with the laser with decompression, right? I can get better results, symptom relief quicker with the structural correction if we get the body to adapt with a modality, but they have to be used appropriately.
Yeah. Yeah. Who here has experience with shockwave therapy? Okay. Dr. A little bit. Dr. Juan, can you kind of give me a little overview on what that is?
Yeah, sure. So I use Softwave, which is, I know
Oh,
Dr. Judson keeps referring to that. That's the one I use as well. So Softwave is an unfocused extracorporeal shockwave therapy. By the way, if you're looking at any research on shockwave, you're going to find it as ESWT, because that stands for extracorporeal shockwave therapy. And what that does is it delivers an acoustic wave into the tissue. Think of it as what we call it mechanotransduction. So basically what that big word means is you have mechanical energy and converted into biochemical signals that do three basic things. Number one, it activates stem cells and fibroblasts. It promotes angiogenesis and collagen remodeling. It also resets inflammation in chronic tissue. So, combination of those things help to, like Dr. Justin said, basically regenerate tissue, remodel the tissue. So not just masking the pain or boosting healing, but literally taking a structure that was injured or scar tissue and being able to physically, mechanically break that down.
so what's the difference then between the way the lasers are working in the soft or shockwave?
So Softwave has a different mechanism, right? Because laser is what we call photobiomodulation. So that's a light source that's directly stimulating at a cellular level, whereas this is converting, so mechanical transduction, right? Mechanical energy is being converted into the biochemical, which then will signal the dormant repair cells, which we think of things like stem cells, which oftentimes with any type of chronic condition, they're dormant after a while. Like they're not awake anymore. And so what this does is it stimulates those cells, wakes the stem cells up so that we can start to heal, bring in an influx of repair cells to start that healing process and really promote that not only by the stem cells, but also bringing more blood flow, right? That's what, I know I use the word angiogenesis. That just means production of newer blood vessels to the damaged tissue. And then you start to repair the collagen type 1 fibers as well. And on that same breath, you're getting rid of the bad inflammation and bringing in the good inflammatory stimulants that you want to be able to actually heal the tissue. So it's different from the standpoint that it's not just bringing more energy and more blood flow, but it's activating very specific repair cells that actually go in there and fix the injury or fix the tissue that's damaged. And it's non-invasive, so it's very outpatient friendly and very, very well tolerated. What I love about the modality is that you do one session and patients feel a dramatic change. I know we were talking about the laser being slow. It definitely is slow compared to the software. Like I'm telling you, do just one session and the patient that has had pain for 10 years, they'll get off your table and for the first time, maybe have a half reduction in pain. So
Wow.
it's very significant as far as like showing patients the efficacy because they can feel the results, right? That's what patients want. They want to know that this thing works. And so, one of the big things is reduction in pain. And I see it work really well with like any type of tendon issues, any tendinopathy. For me, I treat the knees. So for the knees, it's phenomenal. You don't have to give a lot of treatments. I usually do like 6 to 8 treatments of this. And I'm telling you, it's like patients will always tell me it's like nothing they've ever felt before. And so I swear by it. I've used it on myself as well, my shoulder. I've had shoulder pain for years, haven't been able to like do anything that works. No rehab, no laser, no amount of adjustments have been able to make my shoulder get better, but this has made tremendous leaps and bounds in how my shoulder functions and performs. So it's been a complete life changer for me and in my practice as well.
See, I think Dr. Juan just made me want to get one.
Commission to Dr. Juan.
I mean, really quick question on the shockwave, because there's shockwave and softwave, but I've heard that softwave uses the shockwave technology, but it's
Brand name.
more intense. But then there's, cheaper machines that are just shockwave that are also being sold to chiropractors. I've seen machines upwards of like $60,000, $80,000, and then other machines that, you can buy for like $2,500 overseas, and so it's like, there's this huge difference. But softwave, I think, is the higher end, the more intense kind of a treatment, so that really in a couple of sessions, people are feeling that big difference versus the other. I don't know, do you have any experience with the two types, and your experience or other doctors' experience with the two different types of shockwave and softwave?
Yes. So typically the ones that you're talking about are more like focused. This is unfocused. So you're able to treat a bigger surface area of the injury. And it can reach the surrounding tissue as well, not just the pinpoint tissue. By the way, Softwave is just a brand. It's not a different type of shockwave therapy, but it is one of the best in its class. It's what they use at the pro level, and it's what they use at, big universities. And so what makes it different is it's got a bigger surface area, but it also goes a lot deeper than, like, for example, a radial, or focus shockwave, which is like the ones that you see a lot. Basically, that can only go up to like 3 centimeters of depth, whereas the soft wave can go up to 12 centimeters in depth. It has a drastic range of power from very little to, power that I don't ever really use in my office because it's that strong. Now, the other thing is that they do have higher powered shockwave, and it penetrates very, very deep. It can be very painful, so much so that they actually use anesthesia for that. So shockwave is powerful, but at the same time, it's very tolerable to patients. So it's like you're kind of getting the best of both worlds with that type of shockwave.
Okay. We're going to start losing listeners here because we're like getting close to the hour here. Trust me, we as humans don't have the best attention span here. So we could sit on this forever also, but I wanted to talk a little bit about, before we get into decompression, is there anyone else that wants to weigh in on the laser, shockwave, soft wave technology? Okay. So time to decompress. Yes. Another dad joke. Not with yoga mats, but with spinal decompression. Some again, just like anything else, some see it as a game changer and others as a hype. So what's the reality, right? Anyone here on the panel have a decompression table? Dr. Josh and Dr. Justin? Sweet. All right, Dr. Josh, since you're going to have to run here shortly, I'd love for you to weigh in on that.
Yeah, I got my first decompression table about 2 years ago. And the reason I got it was because I was receiving a bunch of patients who were having chronic low back pain. And on X-ray or an MRI, we would see, a protruded disc, we'd see a bulging disc, we'd see, a lot of compression, arthritic change, things of that nature. And so, it's kind of one of those situations where it's like, yes, chiropractic is effective, but at the same time, we need more modalities to help with them. So non-surgical spinal decompression has really been an answer for a lot of people who have walked into my office, or maybe they didn't walk, maybe they were rolled in here. But that being said, I've seen some tremendous results in terms of discopathies, any kind of disc issue that we're talking. We have several protocols. We have the Hill DT table, which is a table where you actually lay supine, so you lay on your back, which tends to be a little bit better for patients, especially with acute disc or acute any kind of sciatica or things of that nature. It tends to be a little bit more of a relaxing posture. And then we elevate their legs. But the table, the reason why I chose this one, there's hundreds of tables out there, and there's chairs and all the things. But the reason I chose this one is because of the sensors that are built into the table. They actually detect the amount of stretch that people are responding to. So if someone starts kind of wiggling, the table actually senses that and it'll stop because it notices that they're kind of uncomfortable, right? If they're kind of like rolling onto a side, which oftentimes is pretty common when you have someone who is very, very acute, and you initially start decompressing them, it can be uncomfortable for them. So I got this table because of the technology that was built in it. And rather than like a belt driven system or a cable driven system, it's got an actuator in it. So it's a little bit smoother of a pull as opposed to, something just kind of yanking you and it being kind of jarring. Right. And so as it comes back together after the decompression, whether it's a lumbar or cervical decompression, it's a gentle coming back together. So it doesn't, what we were finding was a lot of patients after their sessions, they would feel great during the session. And then as soon as it closes up, they're like, oh gosh, there it is again, and so this kind of prevents as much as possible. But, to answer your question, I love our decompression table. I've seen people who couldn't walk, couldn't even get out of their car or barely get out of their car, go from, a 27 out of 10 pain to now a 3 or a 2 out of 10 to where they're racing their kids on the beach, and that's the cool thing about decompression is that they were staring at the face of surgery or a needle or some kind of procedure that may or may not have worked. And I always kind of come at the patient with, you don't have anything to lose by trying this, but if you do something permanent like a surgery, there's really no going back from that.
Oh, absolutely.
And so,
Absolutely.
and when
Yeah.
we say that, most patients are like, you're not wrong.
Yeah.
And so we have those discussions at length before we have them
hmm
on. But, we institute like a trial period. So we'll do like 1 or 2 sessions just on us for them to try it, see how they feel. Most people do very well. There's occasional people who are, a little bit claustrophobic, don't like the idea of being strapped to a device or something like that. They tend to struggle with that, but that's why we do the trial, is to make sure that those aren't issues for them moving forward.
Thank you for that. Dr. Justin, we'd love for you to talk to us about your experience with the decompression, why you got it, what it does.
We have a little different decompression here. The Hill table is probably one of the best in the business. I was trained by Hill doctor with I think it was a 98% symptom resolution by him. Right. So that's unheard of in our world that you're going to get those kind of results that quickly. And so we do use the decompression table for some of our patients with these disc issues. When we go back into looking at the disc itself, the New England Journal of Medicine comes out and says that at least 54% of people are walking around with a disc injury. It's just a matter of if it's symptomatic or asymptomatic. And this study was actually 54% were asymptomatic, right? So how many more people actually have a disc problem that are symptomatic? And that's who generally walks into our office, right? So, while we have the decompression table, that's not our focus. Restoring the structure to take the pressure off the disc is my focus, right? So we have it, and it's amazing tables, and decompression is 100% different than a traction table. What Dr. Josh has is a decompression table. It is actually pumping disc. It's not just pulling on it and letting go like you talked about. It's pumping a disc. That's why it works so well. And I'm assuming he probably has a red mat underneath, something like that as well. Using back to quantum physics, using different physics for that. But the decompression is great, but we also need to work on restoring structure to take the pressure off that disc, so that way it's not reoccurring all the time.
What is the difference between a decompression table and a traction table?
Yeah, traction table is just that. It kind of statically holds traction, and it used to be kind of the old way that we address decompression, or address a disc. Decompression truly is there's more of a science behind it, in terms of we are actually pumping, imbibition, I think is what we call it, or really just pumping the nutrients into that disc and the end plates. And so there's a lot more physiological change that is happening as a result of that, as opposed to just opening and then closing.
So actually, Dr. Justin, when it comes to the scoliosis treatments, like I saw my kids go through in your office, I'm wondering if that same kind of concept might actually make a difference instead of the constant, like hold. Is there benefit to having some sort of decompression technology to do that pull while they're in that chair? I'm wondering. I just kind of came to mind.
Yes, and I've spoken to the makers of Hill DT about this concept and about
Mm,
applying these kind of protocols. The difficulty part is if there's 36 vertebrae in the spine, there's 36 permutations. There's almost an infinite number of scoliosis cases. So there's no one way that fits right for scoliosis. So it's impossible for them to say, here's what we can do for this scoliosis case, because everybody's a little bit different.
mm,
The theory is solid right on to implement that in scoliosis cases too, because scoliosis is a rotation and a torsion down to the spine. So if we're able to take that torsion back out and derotate that, such as decompression, that could have phenomenal results. However, it's been difficult to work that decompression specific for this scoliosis.
mm. So, okay, maybe I'm simplifying this, right? Obviously, I am, but it's a lot more complicated. But so when I seen you put my children in the chair with the straps, I don't know what it's called, but you have to put the strap in a specific place for each child. It's not like the same thing. You had to have seen their x-rays and know what their spine looks like and know what the curve looks like. Maybe whoever's listening to this behind this technology, maybe there's a way to adjust that. Like maybe the doctor can adjust that so that you can create something like this for an infinite type of scenarios or types of scoliosis. I don't know. I'm just throwing that out there because I've
That would be great. Some of the tools that I use work on like ligament creep and repetition. As a matter of fact, we have a manuscript that we're working on right now about the importance of a repetition. So if you come to my office and we're doing scoliosis care, you're in my office for 5 to 6 hours a day for 2 weeks, and we're taking 10 to 15 degrees off your scoliosis, and then sending you back to Dr. Juan, right? And so our goal is to make massive changes quickly. But we do that through derotating the spine and that ligament creep. The more pressure you put on that spine over 15, 20 minutes, the more creep that will go and that will start to return back to where it should be. Now, the decompression will work on that torsion and it will work much nicer than with static traction. But we're working on finding that happy medium.
Got it. Got it.
I think that it's necessary to have static traction when you're talking about changing structure, right? Because the ligaments need, I believe it's 8 minutes at minimum is what the research shows for change in that ligament to actually take place long term. Correct me if I'm wrong, Dr. Justin. And so if you're doing, I feel like if you're doing compressive where it's like changing, there's a certain protocol where it's fluctuating, you're not going to get that same amount of consistent stress needed to be able to alter the ligament laxity or ligament structure. Now, if you look at decompression, what it's really good at, and the research shows that decompression reduces intradiscal pressure to literal negative values. So you're literally sucking herniation back in. So that's why it's amazing for patients that have hot disc or herniated disc or any type of radiculopathy. This is where I see the success in my office, is because you're literally sucking whatever herniated material is in the spinal canal. You're literally able to suck that back in, which is going to remove that pressure on that nerve and that irritation, and therefore allow the symptoms to dissipate long term. So I love the decompression, and then because of the lumbar decompression or spinal decompression, I should say, I've gotten the knee decompression. That's been really cool. The other thing with decompression is because there isn't a lot of blood supply to your discs, when you do that decompressive force, you're actually able to send in more nutrients and more blood flow and move the synovial fluid around when we're talking about a knee, so that those ligaments can actually heal a lot faster. Where in normal states, for example, when you look at a meniscus, the deeper you go into that meniscus, you're not going to have virtually any blood supply in there. So if you have a meniscus tear deep within, it's never going to heal on its own. So being able to use that decompression really helps to get a lot of that blood flow in there, bring in oxygen to get those tissues and those ligaments to actually start to repair. And now you couple that with something like shockwave therapy, it's a complete game changer. And so that's why when I found those two modalities, I decided to specialize in just knee stuff, chronic knee pain.
Awesome. Thank you for that. Dr. Josh, I know you have to run here. I appreciate you sticking around a little bit longer.
Got to go treat some patients.
Yeah, to talk about the decompression here. So I appreciate you, and we'll catch you in the next one.
Sounds good. Appreciate you.
Thanks, Dr. Josh.
Thank you so much.
Thank you, Josh.
So for the rest of us here, I want an honest answer here, right? What's your most expensive coat rack in your clinic? Because I buy some tech that I'm like, oh yeah, this is the coolest thing in the world, and then it ends up being like a paperweight or a bookend, right? That gadget that you thought would just change everything, but now just kind of holds the jackets. Or are you guys so calculated in your decision making that this never happens to you?
Well, yeah, for me, it's been these roller beds, these massage roller beds. You can't bill insurance. They're just kind of, I say it's an extension of my waiting room, but they're $3,000 each. And that's my biggest paperweight, is those 3 tables right there. So when they break, I'm not replacing them.
Yeah, they're out.
Right. I mean, the other thing most expensive is my x-ray machine, but that's extremely valuable.
For sure.
Obviously the adjusting tables, but those get used every single day. But yeah, it's these roller beds that if I were to rethink my decision, I probably would have gone a different direction with those.
Oh, thank you for your honesty. I appreciate that. All right, cool. Yeah. Okay, so we're gonna close this out with a little bit of a lightning round. So what I'm gonna ask a question. Dr. Juan, we'll start with you. Very short. We're not gonna be long-winded. I know you guys are very smart and have a lot of information in your brain, but we're gonna be quick with these. I'll start with you, Dr. Juan. Dr. Brett, you'll be second, and then Dr. Justin, we'll leave you for last, but not least, of course. All right, so here we go. Dr. Juan, what's one scientific insight you wish every chiropractor knew before they invented or invested in a modality? Go.
One scientific proof that they knew?
One scientific insight that you wish every chiropractor knew before they invested in a modality.
So it has to be about chiropractic? Sorry, I'm just trying to understand your question. Chiropractic insight? So that you want chiropractic insight for a modality that may not be chiropractic?
So let's say a chiropractor bought, and I can even keep this in too. I love this conversation. No, but I'm saying chiropractor, Dr. John, I hope I'm not offending anybody here, but Dr. John decides I'm going to buy this machine because, his colleague told him, oh, it's the best, but didn't realize that it had this kind of negative effect or whatever the case may be. Right. So if there's a specific thing that you're seeing out there in the chiropractic industry that people are doing or using or performing that shouldn't be, like maybe there's something that they should have known from a scientific perspective on how the body would react to that particular thing. So the question now is, what's one scientific insight you wish every chiropractor knew before they invested in a modality?
Well, the first thing that came to mind was the famous Y strap that some chiropractors are using, especially on social media. You see that pretty ubiquitous out there. But basically, you're putting an extreme amount of tension and force and transmitting that through that strap and into the neck and putting an ungodly amount of stress and force on those ligaments. I don't think that those ligaments are supposed to do that on a consistent basis like that. And that could definitely lead to injury, long-term hypermobility, instability, things of that nature. So I would say that's the first thing that popped into my mind when you said that. I think I don't know if we should even do research on it personally, just from an ethical perspective, but
Yeah. No, I actually agree. And I knew one of you were going to say that because I see those videos and I'm like, oh my gosh. All right, Dr. Brett, same question.
I don't know. I can't. I was trying to think a lot, but like, I don't know if Dr. Justin has something. Maybe we can go to him. Let me think a little bit.
Sure, Dr. Justin, go for it.
The first things I think of before any chiropractor should probably be purchasing anything is structure and function, right? We know that the structure determines function of the body. So if we want to get really good at getting the body to function properly, as we all do, we need to get really good at what the structure should look like, what it shouldn't look like, how that structure actually works and functions to influence our function. And then we can kind of go from there. We got different doctors on here that specialize on different things right now, and they're really good at that, but they understand the structure and the function and how to modulate that.
Got it. Dr. Brett.
Okay, so let's go with this. So, a culmination of all of the modalities, I think just appropriate application. I think Dr. Justin was saying things like this, but when a patient comes in after your assessment, hey, you know what? I think doing the laser and shockwave might be good for her. You know what? Hey, your discs are like this based on the MRI. Hey, decompression is going to be best for you. Instead of trying to make a modality fit for an injury that it may not get the best result in. Right. So just knowing the mechanism behind the modality and from the examination and things like that, just knowing when that's going to be fit appropriately to the patient's condition.
Got it. Well, Dr. Juan, Dr. Brett, Dr. Justin, and Dr. Josh, who has had to leave, thank you really for all your insight. I think we need to start wrapping it up here, but looks like Dr. Juan has one last thing to say.
yeah, I just that kind of made me think of like what to think about when integrating a modality, right? Like what do you know, like how do you know what to use for certain cases? So after you assess a patient, I ask myself basically three things. Does it promote biological repair? Number two, can it be integrated safely and efficiently into patient care? That's really important, right? Patient flow and that kind of thing. And then third, will it produce a durable functional outcome for that patient? In my opinion, so out of the modalities that we spoke of today, SoftWave definitely meets all three. It's practical, it's evidence-backed, and clinically powerful. And then I guess to close out this whole thing, I like to quote something that Hippocrates said: "The physician treats, nature heals." Okay, so SoftWave therapy doesn't just mask pain; it activates the body's own repair mechanism, restoring function and reducing the risk of re-injury. For any chiropractor or clinician, like understanding the science behind, in this case, I'm talking about shockwave therapy. So understanding like mechanotransduction or regenerative shockwave therapy, like what those is, that it's essential before you start, investing in these types of things. But, I guess I say that to kind of emphasize the importance that I put on shockwave therapy in my clinic, because it's truly been a game changer for me, and it's helped a lot of patients free them from their pain.
That makes sense. Well, again, gentlemen, thank you so much for joining me today. I appreciate you guys coming on.
Cool. Thanks, man.
Thank you. Well, this has been an incredible conversation. A big thanks to our panel for bringing not just opinions, but science, proof, and stories that matter. To our listeners, I hope this gave you a deeper look into what makes chiropractic modalities practical, not just popular. I'm Amin Said, the guy that really doesn't know much, that brings the people that know a lot. And this has been another episode of Beyond Adjustments. Until next time, keep asking why, keep learning, and keep adjusting beyond the adjustment.